unnoticed, unstoppable. That's how irony respiratory system is to any alive being. It is a system that is seldom talked about, but we can never live without. The main component of the respiratory system are identified by Cleveland Clinic 2024 and many others, in which it consists of the lung, trachea, bronchioles, diaphragm, nose and mouth, with the main function to breathe in oxygen and breathe out carbon dioxide. It also helps protect us from harmful particles and germs and allow us to smell and speak. However, this process doesn't always run smooth. For some people, breathing can become a daily challenge due to a common respiratory condition known as asthma. Always heard, rarely understood. What actually is asthma? According to World Health Organization, asthma is a major non-communicable disease affecting both children and adults and is the most common chronic disease among children. Asthma affected an estimated 363 million people in 2023 and causes over 442,000 deaths. Most asthma-related deaths occur in low and low-middle-income countries where under-diagnosis and under-treatment is a challenge. Although asthma can be a serious condition, it can be managed with the right treatment.
So next, I will explain about the normal respiratory physiology and the pathophysiology of asthma. First, normal respiratory physiology refers to how the respiratory system normally functions during breathing. The main function of the respiratory system is to supply oxygen to the body and remove carbon dioxide. During inhalation, the diaphragm contracts and moves downward while intercostal muscle expands its chest cavity. This causes air to enter the lungs through the nose and mouth, then pass through the trachea, bronchi and bronchioles before reaching the alveoli. In the alveoli, gas exchange occurs. Oxygen diffuses into the bloodstream while carbon dioxide moves from the blood into the alveoli to be exhaled from the body. Normally, the airways remain open, allowing smooth airflow in and out of the lungs. But it's different with asthma. In patients with asthma, the airways become hypersensitive to triggers such as dust, pollen, smoke, exercise, or respiratory infection. When exposed to these triggers, inflammation occurs in the bronchial tubes. The airway walls become swollen, excess mucus is produced, and the smooth muscle around the airways constrict, which is known as bronchoconstriction. As a result, the airways become narrow and airflow is obstructed. This makes it difficult for air to move in and out of the lungs, causing the symptoms such as wheezing, coughing, chest tightness, and shortness of breath. Unlike normal respiration, where airflow is smooth, asthma causes restricted airflow due to inflammation, mucus accumulation, and bronchoconstriction.
Now, let's look at the signs and symptoms of asthma. The most common symptom is wheezing. That is a high-pitched whistling sound heard during breathing, especially when you are exhaling. Patients may also experience shortness of breath, making it difficult to perform daily activities or physical exercise. Another common symptom is chest tightness, where individuals feel pressure or discomfort in the chest. Prolonged coughing, especially at night or in the early morning, is also frequently reported. These symptoms may vary in severity and often occur in episodes known as asthma attacks. During severe attacks, the narrowing of the airways can reduce airflow to the lungs, which requires immediate medical attention. According to the National Heart, Lung and Blood Institute 2024, asthma symptoms can worsen during exposure to the triggers and may interfere with sleep, work, school, and overall quality of life.
Research suggests that the causes of asthma is due to a combination of genetic and environmental factors. Genetic factors play an important role because individuals with a family history of asthma, allergic, or other atopic conditions are more likely to develop the disease. Environmental exposures can also contribute to asthma development and trigger the symptoms. Common environmental risk factors include exposure to the cigarette smoke, air pollution, dust mites, pollen, mold, pet dander, and occupational irritants. Respiratory infections during early childhood may also increase the likelihood of developing asthma later in life. Moreover, obesity also has a high risk of asthma because the excess body weight may contribute to airway inflammation and reduce lung function.
Diagnosing asthma involves a combination of medical history assessment, physical examination, and lung function testing. The most commonly used diagnosis test is a spirometry. This test measures how much air a person can inhale and exhale, as well as show how quickly the air can be expelled from the lung. For patients with asthma, spirometry often shows airflow limitation that improve after administration of a bronchodilator medication. This reversible airflow obstruction is a key feature of asthma. Additional diagnostic methods may include peak expiratory flow monitoring, bronchial challenge testing, allergic testing, and measurement of exhaled nitric oxide levels. These tests help healthcare professionals confirm the diagnosis and assess the severity of the condition. Early and accurate diagnosis is important because it allows appropriate treatment to be started, helping to prevent asthma attacks and improve long-term disease control.
Now, let us discuss the treatment of asthma. The first treatment is inhaled corticosteroid. These are the most commonly used long-term controller medication for asthma. They work by reducing inflammation and swelling in the airway, making the air passage less sensitive to asthma triggers. As a result, patients will experience fewer symptoms and a lower risk of asthma attacks. Common examples include budesonide and also fluticasone. The second treatment is leukotriene modifier. These are the oral medication that help control asthma by blocking the leukotriene, which are the inflammatory chemicals involved in airway swelling, mucus production, and also bronchoconstriction. By reducing this effect, leukotriene modifier helps improve breathing and reduce the asthma symptoms. An example of this medication is montelukast. The third treatment is biologic therapy, which is commonly used for patients with severe asthma that is not well controlled with a standardized medication. Biologic therapy targets specific component of the immune system that contribute to airway inflammation. By reducing excessive immune response, this treatment can decrease the frequency of severe asthma attack and also improve the overall asthma control. The first prevention strategy is avoiding exposure to asthma triggers. Common triggers include gas methane, pollen, cigarette smoke, pet dander, and air pollution. These substances can irritate the airways and trigger inflammation, causing the air passage to become narrower and making breathing more difficult. Therefore, identifying personal trigger and minimizing exposure to them can help reduce the frequency and severity of asthma attacks. Second prevention strategy is adhering to prescribed asthma medication. Patients should take their controller medication regularly, even when they do not have symptoms, because this medication helps control chronic airway inflammation. In addition, proper inhaler technique is also important to ensure that the medication reaches the lung effectively. Consistent use of prescribed medication can improve asthma control and reduce the risk of severe exacerbation. The third prevention strategy is monitoring asthma symptoms and follow an asthma action plan. Patients should recognize early warning signs such as coughing, wheezing, chest tightness, and also shortness of breath. An asthma action plan provides guidance on how to respond when symptoms worsen and when medical attention is needed. Early intervention can prevent severe airway narrowing and help avoid emergency hospital visits. The first complication is airway remodeling. Airway remodeling refers to permanent structural change in the airway caused by chronic inflammation. Over time, the airway wall becomes thicker and less flexible, resulting in narrowing of the air passage. This can reduce lung function and make breathing more difficult, even when the patient is not experiencing an asthma attack. The second complication is severe asthma attack, also known as asthma exacerbation. This occurs when asthma symptoms suddenly worsen due to increased airway inflammation, bronchoconstriction, and also excessive mucus production. During a severe attack, patient may experience intense wheezing, shortening of breath, chest tightness, and also persisting coughing. Frequent exacerbation can interfere with daily activity and significantly reduce quality of life. The third and most serious complication is respiratory failure. In severe case, the airway may become so narrow that insufficient oxygen reaches the lung and the rest of the body. As a result, the body organ may not receive enough oxygen to function properly. Respiratory failure is a life-threatening medical emergency that requires intermediate treatment and hospitalization. In conclusion, asthma is a chronic respiratory disease that can affect the airway and make breathing difficult.
Throughout this presentation, we have discussed about causes, pathophysiology, symptoms, treatment, prevention, and the complication of asthma.
Although asthma cannot be completely cured, it can be managed effectively by proper treatment, avoiding trigger, and also regular monitoring.
By increasing awareness and understanding of asthma, individuals can better control their symptoms and improve their quality of life.
Thank you for watching.